in terms of the ICT, the Ministry of Health, KHF, has been heavily engaged in the development of the draft bill at a national level. At some point in 2 weeks ago, or thereabouts, we were surprised with the county health bill, which we actually made our own submission, and thanks to CarePay, they were able also to really give a quick turnaround on the feedback, also having been involved in the development of the national e-health bill. But basically we are saying merge the two, just have one, the national e-health bill. So that seems to be also the thinking of the ministry, and we believe that we will only have one e-health bill. For those of you who have not seen the draft e-health bill, just write to the Secretariat, we will provide you with a draft. Then there was a dashboard on national COVID-19 response capacity building that was sponsored by, which was led by the Ministry of Health. They invited KHF among other stakeholders, and CHAI was a sponsor. That has been developed, but because, of course, of the current low offtake, we're looking at what can we do with that dashboard now, and I think there are very good ideas around it. Yeah, so it's basically, but more important for us is the private sector-led dashboard. I think it's in the next page. No. So we are developing, and we, together with Smart Application, we're also developing a dashboard for data exchange and, the important critical aspects between our facilities who are members of KHF and outside. We have sent out the call for information. We have not received anything, but now we will call the relevant facilities one by one, just so that we explain the need, so that they can support us to build this platform or dashboard that will be KHF-led. Then private sector facility data integration with MOH systems. So there's a pilot that is almost complete, where at the end of the day, it aims to get rid of all the manual data entry, those big books, so that data, especially on the immunization part, and more so COVID-19, but also the other immunization. So again, so we have, our chair has volunteered his facility, and that is almost, I think in another 2 weeks, the pilot should be complete, and then we'll scale it up to the other facilities who would be willing and to actually get rid of their paperwork, those vaccination booklets among, manual records, so that data is automatically sent to the MOH database. So you don't need to have the paperwork done. So I think that is quite transformational. As soon as that is done, we will we will launch it, and also now start inviting, it's for everybody, public sector, faith-based, and private sector facilities that do vaccination. And of course, based on that model, we will roll it out to all the other areas where documentation is required. And I think that is a good step from a KHF perspective to really, transform the way MOH does their thing and digitize. Digitization is the way to go.